In this video, we will be looking at the types of movement that we see at joints. So movements at synovial joints are grouped into four main categories. First off, we have gliding. Second, we have angular movement. Thirdly, rotation. And then fourthly, special movements. So first off, we have gliding here in this picture. This is quite a simple movement in which nearly flat bone surfaces move back and forth and slide with respect to one another. There's really no significant alteration in the angle between the bones. Gliding movements are limited in range, and this is due to the structure of the articulation capsule and the associated ligaments and bones. So here you can see some gliding between carpals here. So it's just kind of movement or sliding side to side between adjacent bones. In angular movements, there is an increase or decrease in the angle between the articulating bones. The major angular movements are flexion, extension, lateral flexion, hyperextension, abduction, adduction, and circumduction. So flexion and extension are opposite movements. Flexion, there is a decrease in the angle between the articulating bones, and in extension, there is an increase in the angle between articulating bones. So here you can see the articulating bones being the femur and the tibia. And here you have this angle here, theta. So flexion is going to be a decrease in that angle, and extension is going to be an increase in that angle. We see the same thing here with flexion and extension at the elbow joint and flexion and extension at the shoulder joint. Both of these movements usually occur along the sagittal plane. There are a couple exceptions to that though. For example, the flexion of the thumb, which involves movement of the thumb medially across the palm at the carpometacarpal joints. So this happens when you touch your thumb to the opposite side of the palm. That's an example where we don't see that along the sagittal plane. Another example is movement of the trunk sideways. This is like right and left at the waist. This movement occurs along the frontal plane and involves intervertebral joints, and it's called lateral flexion. Now, continuation of extension beyond anatomical position is called hyperextension. See a couple of examples here. So this is beyond anatomical position. Abduction, spelt abduction. This is movement of the bone away from the midline. So you see that here and here. And adduction, spelt adduction. This is the movement of a bone toward the midline. So you see that here and here. Essentially, adduction is a movement that returns each of these body parts back to anatomical position. Both of these movements usually occur along the frontal plane. Now, the midline of the body is not used as a point of reference for adduction and abduction of the digits. In abduction of the fingers, but not the thumb, you have an imaginary line that's drawn through the longitudinal axis of the middle finger here, and the fingers move away from or spread out from the middle finger. In abduction of the thumb moves away from the palm in the sagittal plane. And then adduction is going to be returning back to anatomical position. Circumduction is going to be the movement of a distal end of a body part in a circle. So it's not an isolated movement by itself, but rather it's a continuous sequence of flexion, abduction, extension, adduction, and rotation of the joint, and continuation in that order. So here you can see circumduction of the hand and circumduction of the foot. In rotation, a bone actually revolves around its own longitudinal axis. An example of this would be turning the head from side to side at the atlantoaxial joint, like when you shake your head no. In the limbs, rotation is defined relative to the midline. If the anterior surface of a bone of the limb is turned toward the midline, the movement is called medial rotation. If the anterior surface of the bone of a limb is turned away from the midline, the movement is called lateral rotation. So you can medially rotate the humerus at the shoulder joint by starting in the anatomical position, flexing your elbow, and then moving your palm across your chest. And then the opposite would be lateral rotation. Medial rotation of the femur at the hip joint would be to move your foot medially, and then the opposite is true when you move your foot laterally. Special movements occur only at certain joints. These special movements include elevation, depression, protraction, retraction, inversion, eversion, dorsiflexion, plantar flexion, supination, pronation, and opposition. Okay, so we quickly go over each of these. So first, elevation. You can see that one here. This is a superior movement of part of the body, such as closing the mouth at the temporomandibular joint. And this is to elevate the mandible. Also, a type of elevation would be shrugging the shoulders. That's at the acromioclavicular joint to elevate the scapula and clavicle. Now, the opposing movement to elevation is depression. Depression is the inferior movement of a body part, such as opening the mouth or putting the shoulders back down. Protraction. This is movement of part of the body anteriorly in the transverse plane. So you can protract your mandible. This is also at the temporomandibular joint by thrusting it outward. The opposing movement to protraction is retraction. This is a movement of the protracted part of the body back to anatomical position. Next, inversion is movement of the sole medially at the intertarsal joints. And then the opposing movement is eversion. Eversion is the movement of the sole laterally at the intertarsal joints. Dorsiflexion refers to bending of the foot at the ankle or the talocrural joint in the direction of the dorsum. Dorsiflexion occurs when you stand on your heels, and its opposing movement is plantar flexion, and this involves bending of the foot in the direction of the plantar or inferior surface. This happens when you elevate your body by standing on your toes. Next, supination. This is a movement of the forearm at the proximal and distal radionuclear joints. That's what this one is. And this supination is when the palm is turned anteriorly. The position of the palm is one of the defining features of anatomical position. So you kind of remember that when you're moving your palm around, it changes one of the defining characteristics of anatomical position. Now the opposing movement to supination is pronation. This is movement of the forearm, again, at the distal and proximal radionuclear joints, where the distal end of the radius actually crosses over the distal end of the ulna, and the palm is turned posteriorly. So this is kind of an interesting thing when we have supination and pronation. Supination, when the palm is facing outward, it's facing anteriorly, and this is when the radius and the ulna, make that a darker color, the radius and the ulna are actually running parallel to each other. Now when you pronate your palm, the radius actually crosses over the distal end of the ulna when the palm is turned posteriorly. The last special movement is opposition. This is a movement of the thumb at the carpal metacarpal joint, and this is where the thumb moves across the palm to touch the tips of finger on the same hand, so to touch the pinky. Here is a table of the movements at synovial joints. We're going to have gliding, the angular movements, rotation, and then all these special movements, and it gives you a description of each, so it'll kind of help you to remember and memorize each of them. Although all synovial joints have many characteristics in common, the shapes of the articulating surfaces vary quite a bit. So synovial joints are actually divided into 6 categories based on the type of movement that they allow. So we have plane, hinge, pivot, condyloid, saddle, and ball and socket. And that's what we will talk about in the next couple slides. So the articulating surfaces in a plane joint, these are flat or slightly curved. Plane joints, they primarily permit this back and forth and side to side movements between the flat surfaces of bones, but they can also rotate against one another. So you have this back and forth, and then also side to side, but then they can also rotate or turn on themselves as well. So plane joints, because of this, they are termed as biaxial, meaning that they permit movement in 2 axes. So an axis is actually, it's a straight line around which a bone rotates or slides. So we're going to have one axis running this way, and then a second axis running this way. So it is biaxial. And if it does have rotational movement, then it's actually going to be termed triaxial. So this is meaning that it allows movement in 3 axes. Some examples of plane joints are going to be the intercarpal joints or intertarsal joints, also the acromioclavicular joint, and the sternocostal joint as well. Next, the hinge joint. This is a convex surface of one bone. So convex is going to be kind of round. And this fits into the concave surface of another. So the concave is going to be like a cave. So that's going to be like one bone concave surface, and a convex surface fits into that cave. So as the name implies, the hinge joint produces this opening and closing motion, kind of like a hinged door. Hinge joints are uniaxial because they typically allow for motion around one axis. They typically only allow for flexion and extension. So examples of hinge joints would be the elbow joint, as we see right here, with the humerus and the ulna being that hinge joint. We also see this in the ankle joint, in interphalangeal joints, and the knee joint is also kind of a modified hinge joint. In most joint movements, this is kind of important to remember, most joint movements we have one bone that remains in a fixed position while the other bone moves around an axis. So in a hinge joint, this one's going to be pretty clear with this, as we're going to see the humerus usually stays in this fixed joint, and then the ulna kind of moves along that joint back and forth. Lastly, on this page, we have a pivot joint. This is where the rounded or pointed surface of one bone articulates with a ring formed partly by another bone and partly by a ligament. So as you can see here in this little diagram on the right, we have kind of this circular bone here surrounded by a ring. So pivot joint is uniaxial because it allows rotation only around its own longitudinal axis. So examples of pivot joints are going to be the head of the radius and its articulation with the ulna. So you can kind of see here the rounded part of the radius, and it's going to be articulating with the ulna. Here, articulating with the ulna on this side, but then also with the annular ligament around the other side. Another example of a pivot joint would be the atlantoaxial joint, and this is where the atlas rotates around the axis and permits the head to turn from side to side. A condyloid joint is where the convex oval-shaped projection of one bone, so you could see here, kind of this is egg-shaped, actually fits into the oval depression of another bone. You can see that there. A condyloid joint is biaxial because it allows for movement around two axes. So here we're going to have flexion and extension. And then also adduction and abduction. So examples of condyloid joints are going to be the radiocarpal and also the metacarpal phalangeal joints. This also does allow for limited circumduction movements as well. And remember that circumduction isn't an isolated movement, but it's kind of all four of these movements together. In a saddle joint, This is where the articular surface of one bone is saddle shaped. So you can kind of see here, it goes down here. This bottom part kind of looks like a saddle. And then the articular surface of another bone fits into that saddle. So kind of have this saddle kind of part here. And then the other bone kind of fits right into that saddle portion of the other bone. So the movement at a saddle joint are the same as those at a condyloid joint. So these are going to be biaxial. So remember, allowing for that flexion and extension, adduction, abduction, and then limited circumduction. So an example of a saddle joint is the carpal metacarpal joint between the trapezium and the trapezium of the carpus, and then the metacarpal of the thumb. So that would be a saddle joint right there. A ball and socket joint. This consists of a ball-like surface of one bone. So you can see that right here, ball-like surface kind of fitting into this cup-like depression of the other bone. So these joints are going to be triaxial. Remember, that allows for movement around 3 axes. So we're going to have flexion, flexion, and extension, abduction, adduction, and then also rotation. So around 3 axes there. Examples of ball and socket joints, they are going to be the shoulder and hip joints are going to be our main ball and socket joints. At the shoulder joint, remember that the head of the humerus fits into the glenoid cavity of the scapula. And then at the hip joint, we have the head of the femur. Right here actually fits into the acetabulum of the hip bone, otherwise known as the coxal bone. So the articular surfaces of synovial joints contact one another, and they actually determine the type of the possible range of motion. Range of motion is abbreviated ROM, range of motion, and this refers to the range, which is measured in degrees of a circle, through which the bones can be moved. And there are several factors that can actually contribute to keeping the articular surfaces in contact and also affecting the range of motion. So first off, we have the structure and shape of the articulating bones. So this is when the shape or the structure of the bones actually determines how closely those bones can fit together. So this is actually going to be a direct physical limitation. Next, the strength and the tension of the joint ligaments. So this is when the different components of a fiber capsule are tense only when the joint is in certain positions. So the tense ligaments not only restrict that range of motion, but they also direct the movement of the bones with respect to each other. We have arrangement and tension of muscles. So muscle tension will actually reinforce the restraint that's placed on a joint by its ligaments that we just talked about prior, and it helps to kind of restrict movement. Contact of soft parts is also an important factor that affects range of motion. So this is the point at which one body surface contacts another body surface, and it can actually limit mobility. Like when you bend your arm at the elbow, it can't move any further after the anterior surface of the forearm meets with the biceps brachii muscle of the arm, and it can't move any further. Joint movement can also be restricted by the presence of adipose or fat tissue. Hormones is another factor here that joint flexibility might actually be affected by. For example, relaxin is a hormone produced by the placenta and the ovaries. This actually increases the flexibility of the fibrocartilage in the pubic symphysis. And it also loosens the ligaments between the sacrum and the hip bone and coccyx towards the end of pregnancy. So this helps for the birth of a child to go easier, for having that flexibility in those joints due to relaxin. Disuse is also another very big factor that affects range of motion. So if a joint has not been used for an extended period of time, movement at that joint might become restricted. For example, when we use casts to set broken bones, say for example an elbow joint is immobilized by a cast, that range of motion at the joint may be limited even for a time after the cast is removed just because of disuse. And that's going to be the end of Chapter 9, Part 3.